welcome again to your own YouTube channel, Ask Your Gynecologist. I am Dr. Sonal Parihar. As usual, I have come back with a new topic for you all, and of course, because we are continuing with the series of infertility, how to conceive, well, I am giving you tips in every video, and this is the last video of this series. Okay, so today we are going to discuss about in vitro fertilization, that is test tube baby. In the previous video, we discussed the difference between IUI and IVF. IUI is the first step of assisted reproduction. Assisted reproduction means the doctor is assisting you to get pregnant. Apart from the medications and the injections that we give you, if you are not able to conceive naturally, then our role comes in. We come in and we try to help you in conceiving by mixing the sperm and the egg together, or by injecting the sperms directly inside the uterus, so that is called IUI. And when we do an IVF, that is called test tube baby. Okay, so before we start the topic, let me just tell you the DocWise app is working very well. It has started working abroad as well, outside India. Patients sitting in US, patients sitting in UK, in Hong Kong, Asian countries or Australia or even Arab countries, they are all contacting me. So there is no as such country in which this particular application is not working. You can just download it from your mobile's Play Store, and it will ask you for my PIN. So this is my PIN. Once you put the PIN, you can connect with me directly. Then you can share your reports with me, just like WhatsApp. I can send you voice message, and I can even call you if you are sitting with inside India. Outside India, I cannot call you because international calling is still not available in this application. But still, you can get a prescription. So it is very much like consulting a doctor in the hospital. So you're sitting at home and you're getting consulting. You're consulting a doctor and you're getting the prescription. What else do you need? You just cannot see the face of the doctor. It is definitely me who is answering all your questions. And there is a package of either 2 days or 6 days. It depends upon what kind of package you want. Other than this, I always go live on my channel, you know that, Ask Your Gynecologist. I've got another channel called Dr. Sonal's Answers. You can subscribe to that channel as well, because I sometimes simultaneously go live on both the channels, or sometimes I go live just here, sometimes there. So if you subscribe on both, then you'll get your answers. And I generally answer the questions questions asked a day before. I do not do live chatting because it is very difficult to answer all the questions which come on the live chat. So what I do is, as soon as the chat is over, I take a screenshot of all your questions and I answer the questions which are general in the next day's live chat. Apart from this, the YouTube has also provided you with Super Chat. Super Chat is something in which you just click on the Super Chat. It starts with Indian rupees, 40 rupees, and once you type your question, YouTube will tell you how much more you have to pay, or whether it is sufficient for 40 rupees. As soon as the question flashes on the screen, I will answer it there and then. You don't have to wait for the next session. Okay, so these are the 3 ways in which you can talk to me. You can directly get in touch with me, but I would say DocWise app is the best because it is very much like consulting a doctor, because you can get the prescription as well. Okay, apart from this, my other portals like Facebook pages, Twitter, Instagram, email, please do not type your questions there because I have restricted YouTube itself for medical channel. Okay, these are all my social channels, social portals, so you can always follow me there, but please stick to YouTube for your questions. Okay, so coming back to the topic, in vitro fertilization. Now, what exactly is in vitro fertilization? In vitro means outside the body. In vivo means inside the body. So that is the difference between, in the English words, vivo and vitro. So what we are doing is, we are mimicking the fertilization which should happen inside the body. We are trying to do that outside the body. We are creating an atmosphere outside your body, just like it happens inside the uterus. Okay, so what are the steps in it? The first step would be to cut down the cycle, the menstrual cycle of the woman, because we do not want her to have her normal menstrual cycle, which is organized by the brain from the hypothalamus and pituitary and then the ovary. We want to take the body under our control. So we will give you some hormones in the form of GnRH. These are the hormones which are normally secreted in your body from the hypothalamus. So when we start giving you these injections externally, the cycle inside your body will shut down. So then we will have your body under our control. We would want you to ovulate when we want. We would want you to have the hormonal surge when we want. That is why we do this. So the first step will be to shut down your normal menstrual cycle. Second step would be to make a lot of follicles. Many follicles are required for IVF, much more than what are required for IUI. Because here we are basically taking your eggs out of the body. So we want as many eggs as we can, because some eggs might not be good quality. Some follicles might be just empty. They might just show up on the sonography as filled with fluid, but they may not be any ovum in it. Right? So what we do is, we basically give you super ovulation injections. We want at least 8 to 10 follicles. And then once the sonography shows that you've got 7 to 8 or 10 follicles of 18 to 20 millimeters optimum size, at that moment what we do is we put an ultrasound probe inside you. The patients who have had a vaginal ultrasound, they know that it is a long probe and that is not painful at all. We put that probe inside you, but to take the eggs out, we need to connect a needle with that probe. Now that particular thing, it is a device which is present in all the hospitals where IVF is going on. So it is slightly painful because the needle has to pierce your vaginal wall, go inside your pelvis and pick up all those eggs which are seen in the ultrasound. That needle is attached to a suction machine, so it sucks out all the fluid along with the ovum, along with the egg. Okay, so this is just maybe 5 to 10 minutes procedure. So for that 5 to 10 minutes, you are given some anesthesia in the form of sedation. You go to sleep, you will not feel anything, and within 10 to 15 minutes back, you'll be back to normal. Okay, so this is the third step in which we take out the eggs from your body. Once the follicles are taken out in that bottle, we take it directly to the lab. Now the role of embryologist comes in, because the embryologist will now examine whether this fluid contains ova, the eggs or not, and how many eggs are there, how many eggs are of good quality, how many eggs have to be used for in vitro fertilization. Once this is done, then the role of your partner comes in. The partner has to give his semen, that is washed, just as I told you in IUI. It is washed and then it is mixed along with the fluid which is taken from your body. The fluid contains ova and the semen, it contains sperms. So they are mixed together. When they are mixed together, we assume that the best sperms and the best eggs will get fertilized. So depending upon how many embryos are formed, we generally do not transfer more than 2 embryos in the body, because we do not want you to land up with triplet pregnancy or 4 pregnancies together, because we do not want to hassle you. And it is very difficult for 3-4 babies to survive in that atmosphere. So we do not want you to have more than 1 or 2 babies at a time. So in case your embryos are good and you produce more than 2 embryos, these embryos can be frozen. This is called vitrification. So extra embryos can be put in the frozen pan, and that is called vitrification, and these can be used in your next cycle. So that saves money, that saves your partner to come back again and again for ovulation, and for your partner to come back for semen preparation, and you to have ovulation induction drugs again. So you do not have to go through all that procedure again. It will just be the embryo transfer which has to be done in the next cycle. Okay, so this is the fourth step in which we mix the semen and the ova together, the follicular fluid together. The fifth step will be to examine it after 3 days, because for these 3 days, these embryos are incubated. It's an incubator just like an oven. We try to create the same atmosphere what is there inside the uterus, because this is what happens in the uterus. The sperms and the eggs, they meet in the fallopian tube, and within the fallopian tube they multiply within 3-4 days. They become like 8 or 16 cell blastocyst and morula, all those structures are formed. And at that particular stage, when they are fit enough to be transferred to the uterus, the roll in a normal pregnancy, they come into the uterus and get implanted inside the endometrium and in an endometrium. In IVF, because we are doing it externally, so for 3 days we have to keep it inside the incubator, creating the same atmosphere just like in the uterus, and then we examine under the microscope which embryos are healthy, which have to be transferred, which are not healthy and can be discarded, and then we do the embryo transfer. Now, how is the embryo transfer done? It is just done very much like IUI. As I told you, in intrauterine insemination, we use a thin pipe which goes inside your uterus, and it is not painful at all. It is just maybe 2-3 minutes procedure. It will just give you slight crampy pain because something is going inside, and then we inject the embryo there, and that's it. And you can go back home. That's it. So no bed rest required after IVF. You do not need to do, you should not do strenuous exercise. As I told you in the previous video, you can do yoga, normal day-to-day exercises, normal daily routine, have intercourse with your husband. There is no restriction as such, but do not please undergo strenuous work, strenuous gymming and exercising, because you are trying to conceive. You do not want any complications in your pregnancy. Okay, so these are the different steps of IVF. Now, just like I told you in IUI, the chances of twins are much more as compared to a normal pregnancy, because we are assisting the reproduction, we are super ovulating you, we are making so many ovas, and we are transferring 2 embryos inside. So obviously the chances of twins will be higher. Chances of miscarriage are higher, right? Now, when do you get the signs and symptoms of pregnancy? As I told you in IUI, it takes about 2 weeks. Right? In IVF, you can say it will be slightly lesser than IUI, because we are bypassing that time in which that embryo develops inside the tube and then rolls inside the uterus and gets implanted, because here we have already made the embryo outside the body and here we are just transferring it inside the uterus. So those 3-4 days are kind of cut down. So you can say maybe 10 days, but I would still say wait for 14 days and then you will get the pregnancy result positive. Generally the doctor will tell you to come back, get a pregnancy test or get a beta HCG blood test, because sometimes urine test might take time but the blood test will show that you are getting a positive result. Okay. Talking about the success rate is definitely higher than IUI, but obviously the cost factor is also higher. Okay, so it depends upon which center you're going. Cost factor I would say would be almost 10 to 15 times more than IUI, but obviously the success rate is almost double. If it is 10 to 15% in IUI, then it is almost 20 to 25% in IVF. But there are so many factors which decide the success rate. It depends upon the patient's age, the partner's age, the semen quality, the sperm quality, the egg quality, then any genetic problem you are having, any chronic disease you are suffering from. These will all affect your egg quality. Your age is a major factor. If you're above 35, the rate comes down. Above 40, again the rate comes even down. So it all depends upon it depends from couple to couple. So we cannot actually say that it has to be 20% or 25%. It will depend upon the conditions. Okay. Then comes another procedure called ICSI. ICSI. That is intracytoplasmic sperm injection. Now this is also a type of in vitro fertilization, but in this case we are assisting the sperm to come and penetrate the egg. Now why do we do that? We do that in cases where the sperm count is very low and the partner is insisting, the couple is insisting that they want a child of their own genetic characters. They do not want to take donor semen. So in that case we pick out that particular sperm using a very big electron microscope which has like a forceps thing, and we can see that particular sperm hanging around, and we pick up the best sperm which is running around and which is very active, and we pick up that sperm and inject it inside the ovum. Now that is a very complicated procedure and it has to be done by a very experienced embryologist. Okay, so the results are excellent if it is done by a very experienced embryologist and if the sperm quality is good and the egg quality is good. So that is again a kind of IVF for couples in which the sperm quality is bad or the number of healthy sperms are less, the count is less. Okay. Now another thing that you should know, and many people ask me, why do we block the tubes before IVF? That's because we are transferring a healthy embryo inside your womb, and in case your tubes are unhealthy, your tubes are having hydrosalpinx or your tubes are diseased, we do not want the unhealthy, unwanted fluid to flow in from the tube to the uterus and damage your embryo. So what we do is we either cut your tubes, we remove them because they are not required, or we just clip them. History says, research says that it is better to remove the tubes, because even while clipping there might be some leakage, because clipping might not be absolutely it may not seal off the tubes completely. So it is better to remove the tubes, but then obviously then you will not conceive naturally after that. You have to have an IVF again. Okay. Now coming to the question, how do we improve the success rates of IVF? Very much like IUI, be healthy, be stress free. Do not give yourself a lot of, do not delay your fertility treatment a lot. Say 10 to 15 years you're just waiting, changing doctors, and that basically will reduce the rate of your IVF success. Okay, so it is better if you just try for 5 to 6 years. Once you are healthy, you're still healthy, you go for IVF, the results will be better. So your egg quality would be better. Try to be healthy, as I always tell you, try to be healthy in your lifestyle, eat healthy, sleep well, anxiety levels should be less. You should have some exercise schedule daily, so that because if you're eating healthy and you're keeping your body healthy, everything will go in the right direction. Your eggs will be healthy. Similar thing will hold for your partner as well, for the sperm quality. Okay. Now coming to the last question, how many cycles should we go for IVF? Well, IVF, as I said, in IUI there has to be at least 6 cycles to give you a result of 10 to 15%. For IVF, at least 2 to 3 cycles to give you a result of 20 to 25%. Now that sounds too much because it is very costly. So as I told you, you can freeze your embryos. You can even freeze your sperms if you think it is very difficult for your partner to come back again and again. You can freeze your eggs as well. So many ladies are doing that. In case you are undergoing cancer treatment, or in case you think that you're getting old, you might not produce good quality eggs later on, so you can freeze them as well. So vitrification is very much in fashion. Now, one more favorite question of my patients is, can we naturally conceive after having one successful IVF? Now, successful IVF does not mean that you have delivered the baby at 9 months. Successful IVF means you had a pregnancy test positive. Whether you aborted, whether you miscarried, whether you had a normal full-term pregnancy, it doesn't matter. So, can you conceive naturally after that? Well, if you are young, then yes. If you have not delayed your IVF procedure a lot, then your egg quality is good, your body is in a healthy shape, then yes, you can have a natural pregnancy after one successful IVF. Similarly, if you are having unexplained infertility, that is, you and your husband, you probably were labeled as unexplained infertility because the doctors could not find any disease in you, but still, after taking so many treatments, medicines and IUI, you could not conceive and you went for IVF. In that case, obviously, your chances of having a natural conception after one successful IVF would be more as compared to a couple who has like delayed their pregnancy a lot, 15-20 years, and they already are diseased, overweight, not very healthy, they had some disease inside them, some chronic disease, some genetic disease, then obviously their chances of having a normal conception after one IVF would be less. Again, there is one more theory, one more study being conducted that patients who have had endometriosis in the past and they went for IVF and had a successful IVF, in such cases, sometimes we have seen that the endometriosis levels come down because in the pregnancy, the hormones, they alter the endometriosis level and sometimes such patients can conceive naturally after one successful IVF. Now, whatever I say does not mean that it will hold true for you because it is medical science. We talk about what we read, what we listen, what we practice. I have been practicing for 20 years, so now I can say many things which have been like happening in my one patient but not happening in the other patient. So please do not take it like Dr. Sonal has said this, so this has to happen with me, because this is medical sciences. All the bodies are different, all the circumstances are different. Right? So that is all, guys. That is all you need to know about test tube baby. In case you have any questions, you can type in Dr. Sonal's answers channel or ask your gynecologist. You'll get your answers. If it's very personal, then super chat or doc WhatsApp. Right? So take care. If you like the video, do like it, subscribe it and share it. Thank you very much.